Everybody doing today? Good. Let's try that one more time. How's everybody doing today?
Doing good.
Good. So I'm going to hang out over here so we have the most space. So if you guys want to kind of watch your step. There's plenty of stretchers. We got a heater there. There's another heater here. I can move that way. Help you guys out. But yeah, we got a lot of cool stuff planned for us today, all right? We're going to move around. We're going to have a chance for Q&A. We're going to learn some things, and we're going to figure out exactly what's going on with our hips and what the root cause could be. Does that sound good to you guys today? Yeah. Thanks, Joanne. Anybody else want to? We got to get moving, guys. It's super cold. The more excited we are, the warmer it'll be, all right? So, like I said, we're going to figure out what's going on with our hip. The first thing we have to do when solving issues is figuring out the root cause, right? Because if not, we're going to just keep shooting into the dark and hope we hit the right thing. When you find the root cause, you're not shooting into the dark, right? You're targeted. And let's try this. Raise your hand if you've experienced, we're here for hip pain, right? So raise your hand if you have hip pain. Okay. Raise your hand if you tried something, stretching, heating, ice, the big systems, all of those things, right? And it's a struggle. And it's not that those things inherently don't work, right? It's that we don't know when we need to do each one and what phase of our care it is, right? And furthermore, traditionally, we've been taught to treat the area of discomfort, not necessarily the reason why we have discomfort. And what we do at Connect is we go after the culprit, not the victim. And the culprit being the cause of the discomfort, the pain, the tightness, the weakness, the instability, whatever it is that you're dealing with. Does that all track with you guys? All right. So, who has been told that, you might just have to live with this, or it's arthritis, or it's age, or anything like that? Me, right? Or this is the best we can get you to, right? It's happened to me. And the reason is because, again, not finding that root cause, right? You can pad the symptoms, you can help alleviate the symptoms, but until you improve function and understand what's going on with that person, we get stuck. All right, so what I want to do is I want everybody to close your eyes, and you're going to point to the spot on your body where you feel your hip pain. And I want you to hold your finger there. Close your eyes and hold your finger there where you feel the hip pain. Now, I want everybody to open their eyes and look around where everybody's fingers are. What do we notice? There's some similarities and there's some differences. So Miley is in the back. Elwood is on the side. We got 3 people. You and I, us 3 are about this, us 4 are about the same. And then Sarah is more internal, right? And so if we were to go to, I'm trying to not get in trouble by the big wigs around town, but if you pick up what I'm putting down, right? If we go to a big box or big mass-produced clinic, right? And we say, hey, doc, my hip hurts. They're going to say, great, here you go. Go do your hip pain exercises. But what we just all saw is all of our hip pain is not the same. And if you get a generic run-of-the-mill program, you will end up in that space of, yeah, maybe it's related to age. Maybe it's just arthritis. Maybe this. Maybe you have to live with it, right? Because they don't find the root cause, because they have your hip pain, whether it's here, 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 or here. Does that make sense? Okay. So, who is concerned that their tightness, their hip pain, tightness, pain, imbalances, weakness will get worse? Who's concerned that it's going to keep them away from something they love? it's going to keep them from doing something they love or being with people they love, whether it's hiking, picking up your grandkids, going to the store, any of that. Well, I don't know if I'm going to the store, but like, well, going to Costco and picking up a case of water, right? And that's completely normal, right? Most people that we work with, that's what they tell us. They say, you know, it's not so bad now. However, I'm 60 and my grandson just was born. What am I going to, when he's 10, I want to be able to play catch with him, right? I'm 25 and I'm a dancer and I can't squat down, but I just got married and want to have a family. Where am I going to be at 35, right? These are all normal things. And these are all things that we help people with. So knowing that, or just because it's tight now, or it's not that bad yet, right? Doesn't mean that we all don't have fear. And that's completely normal. Okay? It's okay if I tell you guys I'll tell you guys a story. All right, so we have currently a patient named Mary. Actually, I'm going to time out. Does everybody know what I mean? Oh no. Does everybody know what I mean by root cause?
Real cause.
The real cause. Tell me more. The culprit. Tell me more. Give me more. All right. So the way I think about the root cause is the real reason. It is the culprit. But what that means is my hip hurts, right? I may have arthritis, right? I may have inflammation. I may have bursitis. I may have tendonitis, right? All of these reasons can be why you have pain. However, all of those reasons are caused by something different. Whether it is your gait pattern, the way you walk, whether it's your dog is in your bed and making you do this, right? Right? Yeah, same. Or whether you broke your ankle 25 years ago and it didn't heal right, or you didn't rehab it right, or you have uneven legs, right? You have, right, you got into a car accident when you were 19 years old and you have metal rods in your back. And all of these reasons play into what we feel, right? And if we don't respect that aspect of us and we don't take that into consideration, we can't get to the other part, right? Does that track with everybody? Yeah. Okay, cool. So back to the story. So Mary was a nurse. She recently retired, and she was also a figure skater recreationally, but she skated at Snoopy's, and she was a NICU nurse. So she spent her career bending over cribs, picking up little 2-pound babies and cuddling them, right? But this is a very challenging motion for 40 years. Does that make sense? And what happened was Mary was skating into her 50s, into 60, COVID hit. Couldn't really skate anymore, mostly because, COVID and stuff. But she went to go back to skating. She fell. She's like, this is not like it was when I was 58. 61 is a little different. Cool. She went back to work a couple years. She goes, my back's starting to get tight. Maybe I should go see someone. She happened to work with my wife. This is a true story. Her name's not Mary, but HIPAA. She worked with my wife, who is real, by the way. She doesn't think. But she worked, and Melissa goes, hey, if you have the time, you might want to go say hi to Aaron. He might be able to tell you what's going on. Yeah, I'm good. I'll wait till I retire. Cool. Go to the retirement party. I meet Mary. Oh my God, I heard so much about you. This is excellent. I can't wait to talk to you. I just retired. I'm going to give you a call, blah, blah, blah. Boom. I don't see Mary. Hear from Mary, nothing. But, everybody has their own path. Who am I to judge? Everyone has a life, right? So roundabout, somebody else has a retirement party from their job. I see Mary again. Oh, what's up, Mary? How you been? Oh, I'm so good. We're in the middle of the move. I'm so sorry I didn't call you. I'm going to get to it. I promise. We're in this middle of moving our house. Great. All right, cool. Where are you moving to? Oh, we're moving from Sebastopol to Santa Rosa. Da, da, da. Like, oh, that's amazing. How's your daughter? Oh, she's good. She just left for college. All these cool things, right? So me and Mary are chatting it up. It's like, as soon as we get this move down, I'm going to call you. Fast forward, I don't hear from Mary, but that's okay because Mary's cool. Mary has a life. Who am I to judge, right? Or even stress her. Like, I don't want to be stressed. I'm not going to stress her. So fast forward, Mary moved. She's living her life, happy retired life in Santa Rosa, going to downtown, hanging out, going to Wednesday night markets, all that fun stuff. But then one day she went to Costco. And she's at Costco, and there's a jug of water. There's a flat of water, right? And we're not going to talk about the environmental damage of the bottles, but that's neither here nor there. Anyway, so she goes to pick up her flat of water, which is about 45 pounds, right? She bends over, picks it up. Oh, no. Oh. Now, guess what happened?
Now she calls it.
Not yet. So Mary blows 3 discs. Mary gets neurogenic claudication. What that means is there's so much inflammation in her back from the bend and twist, from this tightness that started that turned to an ache. I forgot that part. But it started as tightness, turned to an ache, which turned to a problem, right? So now she has a problem. Mary is stuck like this. Neurogenic claudication, essentially what that means is the nerves that are in a certain area are hypersensitive and inflamed, right? From whatever type of damage was caused, right? And when it happens, you can't stand up straight because when you stand up straight, it puts pressure on those nerves, specifically in the low back. So she's hanging out like this. And then as you walk, because the nerves are sensitive, they start to fatigue and your legs don't work as well. That's where we are. So being part of, anyway, she went to the path that she knew was the hospital, right? They gave her some shots. They gave her some medication. They gave her some, oh, try this exercise. And guess where Mary is currently? Well, not for this part of the story. Guess where she is? She is in pain, but she's trying to, she gets worse. Now it's Thanksgiving. And her whole family's coming to town. And she's stuck here. Thank God for Oliver's. They hooked it up. So that happened. She struggled through Thanksgiving. We're at Christmas time, same thing. She probably went from, let's say, a 10 out of 10 to like 8.5. So some change, but now we're like 6 to 8 weeks in, right? Finally, she's like, oh, Kaiser goes, yeah, we'll see you in 3 weeks. Try this. Wasn't supposed to say that, sorry. But they go, we'll see. No blame. But they did the best they could with what they had. And what they said was, my back hurts. This is your symptom. This is your paper. Take it, see you in 3 weeks. 3 weeks later, same position. So now, finally, she calls me. She's sitting, some of you have been in for a DVs. She's sitting in my office on my table during the DV. She looks at me and her eyes water up. And I'm not saying this, yeah. Her eyes water up and she goes, I'm really angry at myself. I was like, why? You gotta be nicer to my friend. We don't need that. And she goes, no, it's okay. I made a bad decision. And I'm like, no. Just lessons. No losses, just lessons. She was like, I should have came when I had the ache. Because I knew this was gonna evolve and I just didn't want to deal with it. And the takeaway that I have from all of that is the perfect timing is right now. And we don't want to be to where, yeah, we couldn't ice skate, but it's okay. Yeah, I can't really work out now, but it's okay. excuse my language, if you guys hang out with me enough, you'll know I have potty mouth. Fuck, this is fucked. Right? And now we're in a bad spot. So that's why we're here. We're going to figure out your root cause, whether you have tightness, instability, imbalance, whatever it is. We're going to figure out what is causing it and hopefully take the next steps to figure out what to do about it. Does that work for you guys? Yeah? Ready to keep going?
Yes.
That's a little dark. We're going to have some more fun, though. All right, you guys doing all right?
Yep.
All right, we're going to get to moving because it's getting cold. So the first thing I want us to do is... Oh, man, I went out of order. All right. All right, so the first thing I want us to do is we're going to just start by moving our arms around. We're going to get warmed up because, sometimes it could be that we're stiff, that we cause stuff. And I want us to kind of get our blood flowing before we start all these tests. And what we're going to do, and let's go back and forth, is we're going to isolate out 3 regions. Our back, our core, and our glutes. And what we're going to do with that, kind of march your feet if you can. And what we're going to do with this information is it's going to help us to determine what could be causing the root cause of our hip pain specifically. Does that work for you guys? Mm-hmm. Ooh. Let's kind of bounce up on our toes, back on our heels. Good. Good. Is twisting okay for people? Are you guys okay with that? Just a couple of little rotations, nothing too crazy, nice and controlled. Let's take a step back and a reach, opposite arm. I don't know what that was. Just alternate, kind of like a skier. Just getting our... Dance is such a great sport. I've been watching ice skating.
Vertebra.
What's my girl's name from?
Elisa.
Yeah, Elisa Lou. Yeah. I watched her last night. I was like, oh. And then the quad god guy. My dude was out there in street clothes last night. He had on baggy jeans and a hoodie. I'm like, all right, my dude. It was the closing ice skate, so they were goofing off. All right. How you guys feeling with this so far? You doing good? Everybody feeling like they can move around a little bit? Mm-hmm. All right, so the first thing we're going to do is we're going to look at how our back affects our hips, okay? So the first thing I want us to do is you're going to go down and touch your toes as best you can. And back up. And we're going to do that about 3 times. And I just want you guys to take note of what you feel. We don't have to go fast. We're trying to experience what we feel in our bodies. Now, what happened? Well, I saw you do this. Yeah? Where? In your hamstrings? Okay. Did anybody else have tightness anywhere? Calves? Hamstrings?
Hamstring and hip flexor.
Hip flexor. Okay. Who else? Lower back. In your lower back. Okay. Anybody else? Hamstrings. Okay. So we had some nothing. We had some hamstrings. We had calves. We had right in your hip flexors. Mm-hmm. Keyword, hip flexors. Hamstrings. I watched you do this, right? And so if we're not able to stand up certain ways, it's going to have to, that tension and that power, and I don't know if power is the right word, but we're going to go with it, is going to have to come from somewhere, right? And then you said in your low back, right? And that may speak specifically, your low back's not functioning as well as it should. So the hips are doing more to help you take over the movements of your back. I can't even bend. Right. So what happens when you have to pick something up? That has to come from somewhere else. I need help. Someone's going to have to assist me. I drive a bus, so if I have a wheelchair, I need assistance. Wow. Yeah, that's hard. Yeah, it is. I got to think of ways to get to the floor, do the straps and all that. Mm-hmm. And then the way you do that, it's going to have to compensate somewhere. right? And whether it's in your hips or your shoulders or whatever, right? Cool. So we all have different stuff so far. Next thing I want us to try is, can we lean down as far as we can to one side and then the other? Let's do a few on each side. Think about what you feel. Who feels stiffness and tightness or pain on one side over the other? Like me, I feel it on my right side.
I did
Yeah.
this. It hurts right here.
Right. So something's going on with the lower legs. Something's going on with those lower legs. Right? And so it could be, so if we're moving our spine, right? And we're feeling it in our leg's connected to our hip.
Bone connected to
I was literally thinking that. You said the eye bone, right? Literally what I was going to say. We're here. But what it's showing, right, is that when our spine moves a certain way, that tension's traveling down our leg. You can't get to your foot and your ankle, right, or your shin and your ankle, calf, without passing your hip. Does that make sense?
Mm-hmm.
Okay. Who else felt something in there? And that's where you were pointing to your pain. Who else got something?
Like ribcage stiffness too.
Uh-huh.
I can feel all the way up here, but absolutely outer.
Yeah. And like, I don't know if, I'm sure most of you guys know, but like thoracic, so ribcage mobility and the ability to control, engage, spread, and contract is one of the number one reasons why people have neck and low back pain, and as well as hip pain too. So, it almost took out Suzanne. Yeah. Right. All right. We got one more for the back. All right. Oh, by the way, my hip pain personally is deep here on the right. When I went to the left, I felt it here, which lets me know something's pulling when I go this way. Okay. So now for the last one of the spine, let's lean backwards. Who gets something in their hips there? I got you. I won't let you fall. Feel free. Yeah. Yeah. What are we noticing? Yeah, let's try it with our arms up if you can. Thank you, Sarah. Low back.
Feeling anything?
Was it just the low back? Did you feel it in the hips and the front, back at all? SI joint. So, guess what's interesting about the SI joint? It is the hip. It literally is your hip. Yeah, so you have like when you think of a sacrum, iliac is like these hip bones, right? Hip bone, or this guy here, the thigh connects there, and that's your hip. And so if you have tension when you go back there, similar side, does that make sense? We have issues with our spine. Okay. Solid there, guys, so far? Mm-hmm. All right, ready for the next one? Mm-hmm. All righty. So, you guys want to do glutes or core next? Glutes, all right. So, I'm going to go grab some mats, and we're going to need partners for this one. So, I don't know.
Okay.
Maybe upstairs.
Okay, I'll go check.
Okay. If not, it's all right. We're going to use the mats with partners.
I have one more in my room.
Just because this is hard and cold. Here, I got one more too.
Not as cushy though.
Yeah, that's fair.
Yeah, if we get down, you can help us out.
Yeah, I got you guys.
I think maybe up in the front.
Huh?
Oh, okay.
Here you go. Yeah, it's soft and pokey. Alrighty. So, first thing we're gonna do before we lay down, we're gonna have partners. So, if you have a jacket on, try to get it to where your hips, you can see your hip bones, or if your shirt is long. Okay? Does anybody know what the hips do? Or the glutes. The glutes, the gluteus maximi, minimus, and medius muscles do? Yes. We all know where they are. But do we know what they do? Stabilize what? Boom! And it not only does it help stabilize the hips, it helps stabilize the opposite hip. So if I'm standing on my right leg, I'm looking at my left hip to see if that's stable and vice versa. Does that make sense? Not only does it do that, it also pushes us, it lifts us, and it keeps our legs from doing this. Okay? Does that make sense? So the first thing we want to do is you're going to get with your partner. One person on the flatter ground is going to stand on one foot. While they stand on one foot, we want to watch their hips. Are they dipping? Are they bathroom? To the right. Are they dipping? Are they wobbling? Are they leaning? Are they turning? What's happening? Or are they able to stay still and static without their foot wobbling around? All of those fun things. Does that make sense? Then, if that's easy, can they stick their foot out? Can they go back? So let's. And then can you catch them? Yeah. So with that, watch them, but also kind of be a friend and make sure there's not a rack behind your head. All right, you guys ready to try that?
I don't know. I've been having vertigo, so I don't
Oh.
know if I can stand on one leg.
Okay.
Okay.
You can. Okay, don't worry about it.
I can help assist
Huh?
just in case.
All right.
Yeah.
So let's
Yeah,
get
hang on to
started.
that.
You wanna try?
Let's hang on to this.
Yeah.
Yeah, while you do it, okay?
Oh, yeah.
And then lift up.
So,
You
Can you
look
lower
straight
your
ahead
right
at
hip?
me while you do that.
so you're.
Okay, on the vertigo.
Nope, you're doing this. Yeah.
Good. And then let's switch. Okay, so for this one, I see this turning in more than the other side.
Stand. Yeah.
Do you have hip pain on either side?
This is the
Oh.
That's the pain. Okay. So if we're seeing this side turn in, we know that this glute is responsible for stabilizing your other side.
Oh.
So if
It
there's
takes
a
some like
laxity here,
conscious.
we can strengthen this, turning out to stabilize your right hip pain. That could be
My
something
glutes are the bane of my
that is the root
existence.
cause there.
It's like the
Think
thing I
about
have to
them
work on the
apples.
most for me personally. Yeah.
I know
It's like
everything is.
yeah.
This
it
has
was
not
bad
been
for a
in
while.
a good shape lately.
Lately?
Yeah.
Yeah, well,
For
this
how
hip
long?
has been hurting, and then
All the
this
time.
knee,
Yep.
and then that one is.
Uh-huh.
That knee too.
Yeah.
For how long now?
It's been a couple weeks.
Couple weeks. Okay. Did anything happen a couple weeks ago?
Huh?
Did
Oh,
anything
nice.
happen a couple weeks ago?
Not that I mean, no
No event.
no
Try
event.
moving with her.
Didn't fall or anything.
Yeah. Okay. And then before a couple weeks ago, is there any injury to that hip?
No, no injury.
Okay, good. That's good. It's a good sign.
I just keep thinking it's age. It's age.
So that glue
What
is
about the
providing the
vertigo? How long
stabilization.
has
The
that
vertigo
been?
Yeah.
started
So
in
the
January.
foot that's down,
Okay.
that is
And
the
was that
hip
the first
that's
time you ever
working.
had vertigo?
Yeah.
Was that the first time you've ever had vertigo?
No, I've had
Yeah.
vertigo before, but this has been
Yeah.
recurring.
And we're just kind of looking to see
spinning.
what's hard and
The
what's not.
spinning is not all the time, but
Yeah.
the
And like
dizziness.
if you're shaky, one hip higher than the other.
Have you seen anyone for that?
Who do you say? You know, I didn't get an appointment until next week.
Yeah.
Okay. Who did you get an appointment with?
With Kaiser.
And
Okay,
so if
yeah.
like
That's a good
But I
start.
know
say
this
your
year
left
it's
hip is the
really
pain one,
been-
right? I think is that the one?
Well, it's
Yeah.
not painful. It's
Yeah.
it's-
So if the right glute
Stuffy.
isn't firing
Like feels
appropriately,
full.
kind
Yeah.
of to only say that just
Okay.
because it was a little wobbly,
Got it.
more wobbly.
Yeah.
Now your
Something's
right
going on.
side is
Yeah,
going to
so
have to
over
take
here.
over.
I hope they'll check
And so
that
you're
for
working
you on that
extra
visit
hard.
and not just
to
check in.
stabilize
Oh, what
yourself
are you
on this
feeling,
side because
you
this
know?
side isn't keeping
So
up.
yeah, because usually with
Does that
the
make
left
sense?
ear fullness,
Yeah,
if
it's hard too though, because like this side is like
the
my
crystals in the
side
ear
and the
contributing
bulge.
to that,
Yeah,
they're
that's what I
making
mean.
Like yeah.
use of the nerves
Yeah.
to help with that.
So it's
But since
probably
you're how long
balancing
has it
that
been?
one.
It's been almost 2 months now.
And so,
I know.
yeah.
Oh, that's awful.
And then also, so then the bowling.
Okay.
So let's
Well,
see it
only
with
a
that
couple weeks
left
for the
leg.
hip, but 2 months for
Can
the
you
vertigo.
can you
Yeah.
go
Okay.
into your like your
Like my fit an issue.
yeah.
Mhm. When you were moving around when we did these,
Yep.
did you
And
feel
then
anything?
can you lift your glute a little higher on the right
As far
side?
as dizziness,
So
In your
you were
hip.
here
my hip,
and it was down like that.
this is just
Can you lift that up?
this hurts
Just out of
to do
curiosity.
anything with it.
Anything. Okay.
Yeah.
Yeah.
Does it feel
Is
like
that
tight?
how does that
Is
feel
it
for you?
stabbing?
There's a stopping
Yeah.
right here.
A stabbing.
Yeah, because
here.
what happens
Oof.
is so in this
Okay.
position, right?
And that is how it
That's
started
a
2 weeks
glute
ago too,
action.
stabbing.
That's-
Okay. Okay. When
Yeah.
we think of
There you go.
usually what causes stabbing, is there any motion particularly that increases the stabbing compared to all the other ones?
Yeah.
Walking.
Walking. Okay, that's
Yeah,
good
it's all
information.
related. And
So,
so it's like
I'll have you
working
take a couple
backwards through that
steps
problem,
forward and you let me know
figuring it out.
at what point in your
Let me
walk
keep
you
going.
feel that.
Thank you. I'm just gonna check up. How are you?
Is it when it's the
Oh,
back
sorry,
leg
let
or
me
the
get
front
you.
leg?
Yeah.
Does it occur when it's the front or the back leg?
Oh,
When
nice.
it's in the back.
Yeah, how's
Okay.
But it was interesting.
Stabbing in the back.
What I noticed in practice.
Okay.
It's like in yoga, the tree pose, right?
Is it when you're pushing
Stabilizing side
off
is your it's not your
or
dominant side.
when it's
The
all the way
dominant side
stretched?
is
Ooh.
Mhm.
Okay. Yeah. It's hip
Mhm.
flexors.
left side being the
Because in
stabilizing
this
side, it's like, I'm gonna
position,
feel that.
it's
Yep.
extended and stressed.
Yep.
For him,
Yeah.
he's left
Okay.
dominant, but
So we
this is
have
left hip
some
right
glute
now.
on the left
Mhm.
and hip flexor on the right so far. I'm just taking mental note.
It is?
There's a
Yeah.
solution for all
But
of
the
it.
left side's the one that gave you the surgery. Yep, because the left side was probably protecting the right.
How's that all feeling, Stacey?
So the right side really needs to
Good?
be strengthened.
Yeah.
Right.
Is there
Exactly.
any particular motion that surprised you?
And that's when we talk about root cause.
Yes.
It's like they fixed the pain point, but the right leg was the issue.
Oh. Yeah.
All right, how's sorry. Yeah? It almost got me again. How's everybody? How's everybody? Sorry. How's everybody doing with that one so far? Yeah, find one side harder than the other? Yeah. So before we get into the next glute one, who found that the side that was painful was a little bit easier to control than the side that wasn't painful?
What if they were both?
Well, then that's okay. That tells us where we are. It's all information.
Yeah, I would
Yeah. And so when we talk about root cause, is it okay if I share what you were saying about your surgery? So what Elwood and Suzanne were just telling me, was that Elwood had a left hip replacement because that's the side that hurt. However, just now, when we were testing it, it was the right side that was the wobbly and painful side. And so when we think about root cause, is it rational to think that the reason why the right hip or the reason why the left hip hurt was because it was protecting the right hip? And he's left side dominant, right? So it makes sense that if my non-dominant side is damaged, the part of my body that always wants to do anything anyway is going to take over. It's kind of like, yeah, does that make sense?
Mhm.
Mm-hmm. mine's more opposite.
Okay.
Just for instance, but yes.
Yeah, just,
It
I
does
mean,
make sense.
yeah, just for instance, I was just putting an example out there. Yeah.
But on top of my hip replacement, I have arthritis in my lumbar.
Right.
So I'm constantly fighting both.
Right.
Well, it's also leg length difference because they added an extra half inch.
No, a whole inch to the device for my hip replacement. And I assumed the doctor thought that I would be needing a right hip replacement. So now, 10 years later, after the hip surgery that I had 10 years ago, my gait is off. My left side hip hurts all the time because I putting so much pressure on it.
Mm-hmm.
And I try to do my 10,000 steps.
But it's hard.
The next morning, my left side just hurts so much.
Mm-hmm.
In his job, he stabilizes his pelvis by sitting in the bus for 8 hours.
Right.
Mhm.
Right. And it's like, what if we figured out what was causing the arthritis, what was causing the hip pain in the beginning, and worked on that? How would that affect the mobility and the pain and the avoidance? Okay. Cool. You guys ready for the next one?
Mhm.
All right, let's have everybody get on the floor, if you can. You need help? No, you don't need me. That's all right.
I can get a
You
chair.
can use a box. You can use a bench or a box. Miley's got you. So what we're gonna do, we're gonna lay back. We are gonna take our feet. We're gonna take one leg, or both feet. We're gonna point our toes up at the ceiling. I don't want my. We're gonna point our toes up at the ceiling. Once we do that, we're gonna lift up. By lifting up, we're squeezing our glutes to lift. We're not just lifting up towards the ceiling. Then, when we're ready, we're gonna take one leg. I'm gonna take my right leg, and we're gonna lift it. What our partner's doing is watching what our hips do. So watch mine. See how that drops? That's looking at my left glutes. My left glutes need some help with that. So then I do the right side, more stable. Right glutes are doing their job. So for me, maybe my right hip pain is because my left, not maybe, is because my left glutes, I was telling you earlier, the bane of my existence, right? I need to work on those some more. So let's all give that a try. Yes.
Everything like that.
Your right leg, your right side hip drops, that's indicating the
Yeah, contralateral. Yep.
is not.
Yes. Because it's well, it's the only one that's down. Yeah.
Too, though. We can
Uh-huh.
modify it. We can
Because
modify
like we
it.
said earlier,
like
I forgot
this.
who it was, said stability. Yeah. All right. Yes. All right. Y'all ready to try this?
We can modify it. So we're going to modify it for you. So I'm going to have you sit like this, like me.
Oh, because this
You're going to scoop forward.
joint angle dictates muscle fiber recruitment. So when you go flat, it's more
And then
hamstrings.
you're
When you
gonna
lift your
put
toes,
this-
it's more glutes. And it's a little
You're
rounder,
gonna
so it forces
stabilize
more
and
stability.
lift up. Good. Anything with that?
Yes.
What do you feel with that? And down.
Yep. And then lift one leg when you're ready.
And then come down. Good.
Yep. Yeah, there you go. And back down.
Now we're going to put the left foot,
So
just the left foot.
that is probably
Anything with that?
piriformis was working, which runs over the sciatic nerve.
Minus on the right. Okay.
Um,
And the right.
piriformis runs over the sciatic nerve.
Anything
And
there.
so if that, and it runs under your glutes. And so if that is
Oh, it's okay.
contracting
Okay.
more so,
So when you
it'll
did
squeeze that
the
nerve and
left
cause a
leg,
cramp.
and you felt tightness in the right.
Try the other side.
The right has been compensating for the left driving,
Yeah.
the left dominance.
And that looks better. And go down.
It's
It was a little more stable.
I don't feel stable right now.
okay. We're gonna get there.
It was better here. So with your
Let's
left
see
hand,
Suzanne's. Let's watch
rub
Suzanne's.
right here. Or both of them. Yeah. Like right there.
So first, driving the heels down.
Yeah. And then see if that helps.
So the heels are gonna touch the ground. Toes are gonna be off. First, we're just gonna lift the hips. How does that feel?
Yeah. And then you can go back down.
Come down.
How
Now
was
you're gonna
that?
lift the right
Was
leg
it
off
the same?
floor. The left heel is gonna be touching the ground.
All right.
Toes up. And then rise up. What do you feel there?
Yeah.
Just a little wobble
And
on
you
the
go
left.
down.
And then other side.
Yeah.
Yes.
Yeah. You got to tell Angelica to do
then
some glute
see the side.
exercises.
Good. Okay.
Yeah.
So both sides, I saw the left.
Yeah. It's the
On
glutes
both
and
sides,
then
when you
working
had
on
the left
so
versus the
squeezing
right,
up here,
I saw the left
those
wobble.
guys,
So there's
and
some
then
instability
relaxing
in
the
your left
deep
side of your
rotators,
core.
like the
So
piriformis.
what am I supposed to be trying to keep them level?
It's
I think that's Yeah.
I'll demonstrate what I see. How about that?
Okay, well, because I don't know what exactly you want. I mean,
I don't know why that scared me so much.
It's not
Do you have any
about
questions?
the goal of the movement. It's
You have any
about
questions?
observing what's happening in the movement already. So I'll show you what I see versus what, because there's not should. It's just what happens in your body. Does that make sense? Okay.
Yeah.
So
Is
for
it?
example,
I think it's your glute because it's
when we
where are you
go,
feeling in
here's
the knee
what
on the
I
outside?
see.
right here.
Yeah.
If I can
So that's
imitate this,
you got it the glutes.
I see
Because what's happening is
the
the
left
piriformis is kicking
deep
on
core stabilizers.
like this guy, and it's gonna pull down here, and
Got
it
it.
pulls the hip, and it attaches right there.
Yes.
And if you're
And then the
kind
core
of dropping
around
in
it.
like that, this
And
muscle
then
does
same
this.
thing
So if you
here.
drop in,
You would
it's
see
gonna
a wobble here.
activate, and then the piriformis does this, and so
It
it's
doesn't have to
probably
go into hip
overactive,
base.
trying
It's
to pull
just
your knee out.
a call
But we
to
need these guys.
activate the deep core a little bit more.
It's always very complicated.
Nah, I got you. I'll show you a picture.
Like psoas, real psoas,
Yeah.
any
It's difficult. It's difficult work.
or
Hi, how are you doing?
any of the,
Yeah, what'd you find?
because I can't rotate around this. I can't rotate around the bones.
Right.
Right? It's kind of like
That makes
so. I'll do
sense.
this thing where I'll try to do my diaphragm, and then I'll try to do rib to hip.
Yeah. No, see, and that's amazing.
Huh?
That's amazing.
Yeah,
That's how you do that.
this.
That's good.
This side's a little different, but you know the place actually I've been thinking about going to this place called Curves, and they have a machine that actually I can only time it
Right, because you pole dance, right? Yeah, and then so like I do somewhat. Yeah, and so like because you're doing that, it's hard because you're doing core engagement and extension at the same time. So it's like hard to not have the hip flexors overact, especially in like the obviously extension ones, right? While you're latched onto the pole, trying to extend without overusing the hip flexors and keeping the core maintained. But if your shape is wrong, then the move is wrong. And so it is a lot of like it's a balancing act. It's challenging.
Right.
Right side, it's like trying to figure out ankle, knee, hip.
Right. But there's hope.
Well, and I can get into a contraction.
Yeah.
And then I can stabilize through the back of my feet. You know, so
Yeah. It's amazing. Amazing awareness.
Well, I've been doing bodybuilding for 47 years. I've trained in modalities, and so when I worked with Eric, I spent a lot of time too.
Yeah.
But there's still things I'm 74 years old. Right? So it's like the operation happened when I was in a car accident, was paralyzed for a year, and then they waited for a year for my
I didn't hear you.
regenerate. Just dynamic. They redid another surgery. It was a
19 hours.
the first one in the United States was done, and they did Kaiser did an additional international orthopedic.
I don't think that will work. It's uneven.
I don't know that he's.
Yeah, and it also
Maybe on the bench.
builds
Let's go over to the
collagen
bench real
strength
quick.
and like connective tissue strength. And what I've noticed in dance in general, but like a lot in pole as well,
You might be able
is
to
that
go
a lot of people are
like
hypermobile,
this.
which is what attracts them to dance because they're good at creating those lines, right? And the thing about collagen is it's kind of like water, right? Where water, if you press it slow, right, you can put your hand through it, easy, nothing happens, right? It's kind of like stretching. But if you slap water or you belly flop, the shit gets hard and it hurts, right? And so our connective tissue is the same way. So if we're only doing slow controlled
And then where do
movements,
you feel
that's how it's-
that?
yeah, we train it, get stronger, but in a different
right
way
side.
than if we do like a burpee or we jump, right? Now we're reinforcing the strength.
Good stabilization.
And that will allow us
Then
to
I'm
have
seeing
more
the right
strength
hip
and endurance
drop.
on the pole. So
the
when we are in
psoas
those
here.
vulnerable positions,
Yep.
that we're not
Good
hanging on by
stabilization,
collagen
though.
and like
Good
connective
stabilization.
tissue, we're hanging on by by muscles. Right? Does that make sense?
No, not at all. That's good. So yeah, I'm just seeing that hip flexor. You did it.
Well, I do, that's part of my exercise that I do in the morning.
How are you doing?
What is that called?
Oh, good. What'd you notice?
Glute bridges.
I'm used to that, but it takes me almost
So, can I challenge you?
all my life.
So do it again.
I have to go
Now tuck your hips. Squeeze your glutes though. And tuck your hips. Now lift one leg up.
Slow is good.
Did you feel the difference there?
so I go slow.
And do it again.
Is it something that you want to be able to do faster?
Tuck your hips a little bit more.
Okay.
And squeeze. And do the right leg. Sorry.
Pain free.
Or left
Got
leg.
it.
Sorry. Tuck.
Okay.
Yeah. So,
And then
when
once
you were doing the glute bridges,
once the pain's
before,
gone, is it
where did
something
you
that
feel
you
it
wish took
before
up
I
less
had
time?
you tuck and squeeze?
If the pain was gone,
Right.
is it something
and then
that
when
you
you
would
tuck
want
and
to
squeeze,
take less
what do
time?
you notice?
Maybe not necessarily do the
Yeah.
exercise faster, but if you weren't in pain
And that was trying to get your glutes to activate.
as long.
Does that make
Yeah.
sense?
Yeah.
Yeah. And so it's that same thing. It's like you're an
Does
athlete,
that really
right?
matter to you?
And so you're athletes,
It's
we're
more so
good
just the
at
pain.
covering ourselves. And we're good at working around things. But that's why we go from like, man, it's not so bad to like, oh shit, I can't pick up the water. Because we're like, I can work around this, I can deal with it
Okay, good.
until we can't.
Okay.
I still gotta go to
So
work.
Yes. And so the other half
trying to like
is
turn on the glutes.
what's left for work.
And, yeah, and then when we can't use our glutes, it goes to our back,
Right?
right?
Mm-hmm.
And then we can't use our back, so now our hip gets beat up.
We run ahead of schedule. We gotta wait our time comes.
Mm-hmm.
I stretch, I get out.
All right.
I do something.
I'm gonna check in and then we'll go to the next.
We gotta find
How's
that
everybody
next step.
doing?
Not static.
Yeah.
Good? You guys good?
Yeah.
Yeah. All right. So, how's everybody doing with the glute testing? They need work. Yeah. Mine too. Revealing?
Well, I noticed that I kind of go in a little bit. So I think maybe some of the lateral medius, all that stuff needs a little bit of.
Mm-hmm. Yeah. Yeah, that's funny. That's great. What about who felt it in their back? Who felt it in their hamstrings? Right? And so that's showing us compensations. If we go to use our glutes and we feel our back, and when we do this and we feel our hip, there's a connection there. Because if we can't use our glutes, and when we try to use our glutes, we contract in our back, and then we go to try to use our back, and we feel it in our hip, we got a problem here, right? We got to go attack the glutes, work on the spine so that it can go back to what we need to do, and then we can fix the hip. Because if we only focus on the hip, where it hurts, and we don't focus on the low back and the glutes, we stay in our cycle. We don't work ourselves out. Does that make sense for you guys? Any questions with that? Sweet. Y'all ready for the last one?
Mm-hmm.
All right, we're going to do a combo. So it's going to be, you can do both. First, we're going to do guys want to start with a bird dog or a dead bug?
Dead bug.
Dead bug, great. I love it. It's a fun name. A bird bug. I don't know. That sounds challenging. Technically, all bugs are bird bugs? Because birds eat bugs? All right, so what a dead bug is. You're going to lay on your back. You want to keep your head flat. You want to keep your entire back flat, and you want your legs up, arms up. Then we're going to lower one leg down, one arm back, as low as we can go. As we do this, if our back starts to arch, our neck starts to go, our head starts to crunch, we know we have some stability issues. It will point out where the stability issues are. As we do that, you may feel some popping or snapping in your hips. That will give us some insight. You might feel tightness in your back or your hips. That will give us some insight, okay? You might find it hard to keep your upper back down. When we go back to talking about the thoracic cage, that will give us some insight. If you can't keep your head, if your head wants to do this, that will give us some insight, right? So all of this is going to give us help onto the root cause. Once we do that, we'll do the bird dog, but let's have everybody go around, try the dead bug, and see what we come up with. Yeah, as best you can. Does anybody need a modification?
Just moving it over to the bench.
All
That's
right,
all.
that works. Yeah.
All right, Joanne, go ahead. Yeah.
Oh, yeah.
I remember dead bug.
Yeah.
Feeling anything on either side, Joanne?
This one really hurts
To go down? What if you let the leg come up a little higher? So this one, we're not going to go as low. What if we kept it right there?
This one?
If we kept it right there, does that feel better?
Yeah.
Okay. And so then let's switch again and then keep that leg, keep this leg maybe, yeah, that far off the ground. It doesn't have to go low.
Right there.
Good. And you feel like you're able to keep the spine on the ground that way?
Yep.
Internal rotation, that's all done.
Yes, yep. On both sides, more on that. And then the left side of the left low back was doing
Good.
this.
Low back and psoas,
And that, okay.
weak adductors.
I think.
No, weak adductors.
Got it.
No. I would
Nice.
say it's
Let's
probably
get control.
adductors was an issue there.
So you felt
but
it
TFLs.
here?
But then the left side, I couldn't really see
And
the
you
right,
felt it
but
here.
the left, every time it went,
Okay.
instead of like being
Okay.
flat, it did that.
Good job.
So it's here. Yeah. Yeah.
You feel it in your shoulder?
And if you're left, do you drive with your
Which
left
one?
hand?
Oh, the left. Like shoulder blade?
Like in the shoulder, it's in the shoulder, and then if I specifically like pull my shoulder blade back, I feel like I can get a little more.
Yeah. But yeah, the left was doing that. So figuring out how to keep
Which
that
hip was
down.
good. What did
and
you feel,
stabilize.
Stacy?
Because if
Your
not,
hip
then that's
pops.
going to pull on the hip flexors.
And that's the one that's been
and all
bothering
of that,
you.
which
Okay.
means this is going to, the TFL will take over for hip flexion, which is probably why the
And
left
this
leg
is the
was doing
snapping
this
hip.
way more.
Anything
than
in the right side?
So how did the
Okay.
obliques
Yeah.
work with that, with him, with this kind of
Going forward,
Got
they
it.
might be over engaged, right? Because you have like the external obliques, then you have like the then you have the two
Then
deeper
you'll
layers,
hear
like
it,
transverse
feel it.
abdominis and
Is that
internal
audible? Like, can you
obliques,
hear
right?
it?
And so we forget to use those. And if we only
Okay.
have, and they're striated differently,
Because I know
right?
when
So
I
we
hear
have
things
here,
in my body, I
we have
can't
here,
necessarily
and then we
hear
have
it, but I
here.
can
And so if we're
see that
only doing the external,
sensation.
we're in this position. So it's probably over
Oh, I can see
engagement.
it too, yeah.
So it's like I can like make it do that. And that's like when I got like that stopping hip there. Like, It's literally, I use the back of my seat
That's like what it was.
to
And then like really
put the maximum
that's kind
pressure
of how it
Mhm.
is.
Yeah.
But then yeah, like when I
because I'm freeway driving.
like
Mhm.
it's like it pops
Going
here.
Here and here.
Right.
Okay, got it.
tightness
Mhm.
fully on my right side.
Yeah.
Did
And
the
it might
clicking
be
on
that
the
you're
dead
doing
bug
it this
surprise
way.
you?
No.
Yeah.
Really?
And if you watch me,
Because of the mountain climbers.
Right, there you go.
there you go.
I do dead bug.
So you're
Yeah.
He's got the trucker
you're
walk.
probably over contracting in the lumbars here,
Consider that.
which goes back to
How
the
do you
low
like
back
it?
thing. Over contracting here, which is not even really allowing these guys to do their job.
Nice. That's super
So
cool.
I would check that and then
Is
figure
it all
out
group
what's
classes
going on.
at F45?
Yeah.
Okay.
And so then all the other stuff is probably going to be tight. But thinking about how do I
To
engage
go
here,
around town
so when
and
I'm stepping,
figure
I'm not
out
here. It's
what I want to do. I
there.
used to do CrossFit at
Does that make
Seismic
sense?
before they closed. It was right here in
Oh,
Winter
well.
Park.
In my seat.
But I'm looking for
That's
something.
a lot for
I'm wondering
a single question.
It's
It takes
definitely
practice and
motivating
time.
to be in a group setting.
if
Yeah,
just
yeah, I
putting
did the
an
5:15
extra
a.m. one.
maybe
Oh my
a
gosh.
little padding underneath
Where in Santa Rosa is it?
Well, there's one over the north
Yeah.
side one.
But it's not that. It's so
Oh, okay.
it's
Not too bad.
this not being able to stay back.
Right, so so a little bit of a pad underneath
Oh,
this
okay.
right sit bone as he's
Sure,
driving.
but
just-
now we're
I
just
think
but that's-
probably
but
the
he's
one
gonna
by
be
24 is a
stationary all
little
day
closer.
anyway.
right.
Right,
But it's always nice to be by
But
because
Village.
that keeps it weaker.
yeah, it's like wearing a brace.
Yeah, well,
And then what happens when when you do that too much? And now,
Well, you're going to teach him how to strengthen that so he doesn't have to.
exactly, because if we overdo that, now it's on the other side. Right?
Yeah.
Okay. Yeah.
I was just thinking about Band-Aids.
Yeah. Well. Right. How are we doing with that, guys?
Got it. More stress on the SI joint. Yeah.
How do those dead bugs go? They're dead. Who felt it was hard to keep their back down? Yeah. Anybody have snapping in their hips?
Yeah.
Popping? Yep. Tightness, maybe in their low back, hips. Who had trouble? Your shoulder? Yep. So that's more of the thoracic issue, right? Who had trouble keeping their head down or their neck straight? Oh, that's excellent. All right. Cool. Ready for the last one, guys? All right. So the last thing we're going to do is we're going to do a bird dog. What that is hard AF. And so what our goal is to keep our bodies from arching here, from hunching here, from dipping, wobbling, all that fun stuff. Sorry, I don't want a plumber's butt in front of all you guys. So what we're going to do, hands under your shoulders, knees under your hips. Shoulders down and back, chin tucked. Oh, also, if your head's dropping, that's giving us insight. If your shoulders do this, giving us insight, okay? So then we're going to lift up, straight out, in, out, repeat a few times. We are watching our partners to see if they do this, if they start wobbling, if the heads drop, what's going on. Sound good? All right, let's see what you guys got.
No, I'll try that as well.
Yeah,
Sure?
Miley's got you guys. Good. Once you get comfortable, try to bring it in, touch, and then back out.
That was a good
Yeah,
transition.
but do it both
Yeah.
ways. Yeah. Oh, you got that, Joanne.
Good. Keep the shoulder blades down. Good. You can straighten your elbows.
Huh?
Yeah, straighten those. But
Yeah.
relax here.
Good.
Yep, good. And then not as much of an arch. Good.
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 And try to kick the legs straight
Okay.
back.
And switch. Good.
You're going out to the side.
And then the other side.
Yeah.
What are you
Oh, there you
feeling
go.
there?
Oh,
Right
yours was
in
good.
the back there. Okay.
Yeah. You should try
Anything
the
else coming
reach
up?
and touch one.
Okay.
Yeah.
Good.
Like I'm pushing away though,
Oh, I don't want to get kicked. Ah.
Tell me more.
just trying to stabilize.
Stabilize. When you have the
Good.
right
That's
leg
where
up.
it gets.
Got it. Yeah. Like leaning to the left. It's like it's pulling you to the left. Okay. So we know that it's
Yeah,
low
that's
back
glutes.
and right glute there.
That's your glutes. Because when you're standing still and you're going out, you're balanced. You're fine. When you come in, what it does is it puts more pressure on the glutes to stabilize you.
And they're not
And you're not stabilizing. You got to work on that. Damn butt. It's literally a pain in your butt.
Good.
It's the glutes.
Awesome.
Can you try to keep this up?
Good.
Yeah.
Are you feeling anything there?
And then can you keep your head up?
I don't really feel anything except for a little bit of a wobble.
Yeah.
Uh-huh.
Ah, there you go.
Where did you
The fight.
feel left?
But I don't.
The fight. Lift it up. Lift it up. The fight. There you go.
Sometimes.
Yeah.
Depends on what I'm eating. Inflammatory foods.
Any culprits in particular?
Yeah, I'm trying to stay off carbs.
You think it's the gluten or just carbs in general?
I think it's sugar. It's sugar, so I'm going sugar.
Brave. Very brave.
Oh,
One of these days I need to.
Oh God, it's like blueberries are my favorite thing, right?
Yeah.
It's like,
Oh, not even natural sugars. Not even natural sugars from fruit. So brave, Suzanne. I said, you're so brave.
well, I'm also, I've been following
Can I challenge you?
inflammatory markers.
Can you not let this
gut
move?
and brain stuff, right? So
Blueberries are also antioxidant, so that's curious. anti-ROS, the reactive oxygen species,
Better.
which is a reason for a lot of like cell breakdown in the body.
Oh, try the other side when you're ready.
Have fun.
Hi. Doctor goes, she does,
So
she's
don't let
really
this
big
move.
on the ketogenic
Okay,
diet.
don't let them move.
And there's another guy by the name of
Right here, don't move, don't move.
Chase.
Can you lift
His
it?
last name is Chase. He
Yep.
had
And then can you let
he had
that left hip
serious
drop a little bit?
injuries. So they deal a lot with the inflammation stuff. And so I'm going to be 74 this next couple months.
It's a lot of twisting on that right side.
Brain stuff. I've had brain injuries.
Like,
I've had different stuff. And
So like cognitive training.
That, a little slightly exaggerated, but kind of like that. So
in a
thinking
severe
about engaging more
senior
here,
complex with
deeper.
people that- I'm like a teenager compared to the people that are there.
On the right
And I'm
leg.
looking at their
Uh,
lifestyle,
Or the right arm.
rib cage to pelvis. So
You sit on the right side.
Comparing and contrasting.
it's your right
It's good.
torso.
Yeah, I know exactly where I don't want to go. I've been fortunate in my life. I've had certified orthopedic manual therapy. And I've been doing this since I was in the 70s.
Depends on a bunch of different
And it's
stuff.
like now that I'm getting older, it's like you can feel it, you can see it.
Oh,
You
like
watch it,
deep
it's like-
intrinsic core
I
stabilizers.
also know
Yeah.
people that are
Intrinsic
older
core
that are doing
stabilizers, like
well
the
because they're
deep
doing the right thing.
breath stabilizing
So
things,
those are the
like
people
creating a
that-
barrel.
Yeah. Something that's come up.
What I mean by
also,
that is,
in
I was
terms
just
of
gonna
diets,
say,
like the
it's
blue
like, you know how a
zone
can of
diets.
soda
You
or like
seen
a
those
seltzer,
documentaries, and they have cookbooks too.
the
I
air
saw
is
them at
coming
Barnes and
from the
Noble the
inside
other
out
day.
and creating pressure, and you can stand on it, walk on it, right?
I have.
And then when you open it
I've been
or you
taking
dent
it,
it,
right,
it's
right, and so I have
fragile.
some on my lip today,
So
and
it's
Oh.
creating
so in the
a
car,
barrel essentially.
What's wrong with your
So like
valve? And I went
in
and looked in the mirror
bracing,
and
not
there's a
enough
red
that you
spot
can't
of methylene blue
continue
on
to
my
talk
lip.
and breathe, right?
Yeah.
But
So I've been
that
taking methylene
versus
blue and I've been doing
that.
my collagen, my
And,
collagen stuff.
and trying to create like a cylinder
I'm just curious,
from
where
like
do
the top of
you
your
source the
diaphragm to your
methylene
pelvic
blue?
floor,
Because I've seen it, but I don't
order
know.
online.
and then breathing into that.
Just order it online. Just go methylene blue and then it comes up on
And
you can order it
connecting
on Amazon.
like neurological connections, yeah.
I'll show
But
you
yeah,
when you
from
come
breath
over
work
today.
connections.
I'll show you. And so what I
Is that
so
what
what I
you're-
do so what I do with it is I put I put it with all my stuff and then I drink it through a straw.
We're finding root cause
It's
today.
all over.
Stained.
Well, I got it in my mouth today.
Somehow.
So I was trying to, it gets
Yeah.
on the counter.
Oh,
because it's
yeah.
a-
I'm sorry.
Mhm.
I'm trying to keep. I'm
trying to
on
explain it.
a mission right now.
It's
Okay.
just
So what you're saying strengthening your left side?
about nutrients and stuff.
Yeah.
Like that. So
Yeah.
it's like aspirin. Aspirin comes from.
Yeah.
I said this methylene blue.
Yeah.
Comes from Pope.
Yeah.
Mhm.
It comes from so it's still a
Yeah.
derivative
Natural.
of a natural substance in the universe. And so
Yes.
I got into it.
It's not lab made.
Yeah, there's a wonderful
Right.
Chinese
So
guy,
then working on the
Dr.
left to
Lee,
create balance.
and
Yeah,
he was
absolutely.
one that did a podcast
Yes,
years ago
I agree with that.
on me, 'cause was
Also, I
having
noticed, I
ear
mean,
fungus.
to get into the gritty, your
And he
shoulders are
said,
elevating.
if you ever have any kind of fungal,
So you were here
he said the
when you were,
methylene blue is really
it was
good.
doing that?
But it's actually
Stabilizing
because if
shoulder?
you've got
Yeah.
fungal stuff
So
in your
working
gut,
on ground,
And it's
like
going to translate.
there's
it
a million and one
translates
things.
to-
But anyway,
through the blood
yes,
brain
you're not
barrier,
wrong.
So the methylene blue
Yeah.
attacks that.
All
In the
right.
gut.
So how's everybody doing with that?
Love
It's
that.
pretty
I'm interested.
impressive.
Good. Sorry, we're a little over time, so I want to make sure we're going. All right. So what did you guys notice about this exercise?
It was awesome.
Okay. Tell me more.
You're easily excitable.
I can do it better than mine.
Good. Good. So that's giving us a lot of
At
insight.
least I thought I.
Yes, it looked good.
All right. Excellent. Yeah. What else? Anybody else?
You do think you're doing it right, but then it's like, I felt like I was thinking my leg back straight, and you're like, think your leg back straight, and I'm like, oh, okay.
Yeah.
So like, it's interesting how like it feels like you're doing something. And you're not.
Right. Right. Like everyone here is active, is athletic, has physical hobbies, right?
Athletic?
Ping pong is a sport. And I've seen your lineage. There's a kid in your family who can dunk at like 12 years old. Like there's something in there. By the way, his grandson, how old is he now?
72.
No, your grandson.
Which one?
The one that can dunk. The one that can dunk a basketball.
He's 6'3". 15 years old.
Yeah, this dude's 15 years old. He can like slam dunk a basketball. There's athletic genes in there.
Oh yeah.
So, so because we're athletes, because we're physical, because we are good at using our bodies, we can create compensations and we can avoid and we can work around things, right? But it's important to know, it's important to realize that if we have things that don't change and they don't go away, right? That maybe it's because we haven't found the root cause. Maybe it's because we're so good at doing stuff and being us that we can work around the small things. And that maybe we shouldn't ignore the tightness or the imbalance or whatever it is in that moment. Maybe we should pay attention to it and put a little bit of WD-40 on that squeaky wheel before it becomes a blown out bag. All right? Yeah, before you pop your balloon. And so with that, our main goal today was to figure out the root cause, right? And we did a bunch of different things going around the room. We did a bunch of different things to help us figure out what could be contributing to our hip pain, right? And so to finish up, I want to go around the room and I want us to all talk about what we found to be some of the most, what we found to be the root cause of our stuff, or like what our triggers were today, okay? So I guess I'll start just to get the flow going. For me, the one thing that I found was really hard for me today was my left glute. When I showed you guys, I was like, I hope this one works. And then I was like, oh, okay, well, at least I'm real today, right? I didn't do my warm-ups today, or my morning routine. So we all have our things. The one thing that did make me happy and surprise me was my bird dog was really good, and I've been working on that. So I'm proud of myself, a little humble self-love. And actually, let's do that. When we do it, what was your root cause? What's one positive thing to say about yourself today? All right? And let's go around the room. Who wants to start?
I'll start. So one thing that I found that was surprising was that even though classically I've had left hip pain, it was actually my right low back that was tight when we were doing these. Everything else felt fine. And then positive focus. I love seeing all of us try and feel and do a little bit of play, because this is what this is, right? You're playing with what is going on with your body and you're getting a heightened awareness of what that feels like. So that's awesome.
Oh, we're all doing it.
Mostly to my right side, compensating, and I've had all my hip surgery on my left side, so why would my most hurtful side be my right side? Because we're compensating.
We're compensating and we fix the problem, not the cause. Like when we think about like a hip replacement, right? We're fixing the degeneration or the arthritis, right? The degenerative disc disease. We're fixing that, but that is a consequence of something, and we don't address what caused it.
We could put a Band-Aid on it. We never solved the root cause.
Exactly.
Something positive, Elwood.
Oh yeah. You gotta say something positive about. Thank you, man. You gotta say something positive about yourself.
I'm getting there.
You're getting there.
You're getting there.
At 72, yeah, it's still work to be done.
Absolutely. Still work to be done. I love that. And the fact that you're still
not giving up.
That's it. Not giving up. I love that. You should tell you how parents are. What else?
I just noticed a lot of things that I wasn't really aware of. It's super helpful to have a partner. Think you're doing it the right way, but then
it's great to have a partner come over and give you that insight where you feel like you're doing it the right way, but you don't really know or see it the same way that somebody else does. So that's super informative, and just a lot of overcompensation in my body that I'm recognizing when I actually think about recognizing. how my glutes are compensating or how they're showing weaknesses in my hips and maybe my back area too. And I generally tend to like try to fight this arch, and like really it's a conscious effort to like keep that pelvic tilt for a lot of stuff that I'm doing. So great tips and help from everyone here. Yeah. So something positive is I'm happy to kind of dive into this a little bit more now. So.
Yay. That's good, Corinne.
Yeah. Anybody else? I love those.
Thank you. I think the proprioception is a really great point, because even though I train regularly, like my hips, I'm not thinking about necessarily what I'm supposed to be working or how I'm incorporating my entire body. So I think for me, it's almost a little neural, like I'm giving up in the movement or I'm not making the connection of what should be happening. So also the awareness that goes into the movement. And what's positive is watching Dr. Erin come over and like different spots on her spine and trying to help her realize where she's having give, where she's getting lazy in the move, not lazy in the movement, but either over contracting or under contracting a muscle. So bringing awareness to your body is really helpful in movement.
It's so tiny. I know, it's so cute. What I finally dawned on me when you were saying, "Oh, my morning routine," I have not been doing my morning routine because of the vertigo. Because I didn't want to do anything that would make anything start spinning, and I'm going, "Oh, I can see the difference when I haven't been doing any stretching." Okay. So I think that's probably a lot of what I'm feeling and it was the glutes, you know. So do I want to be dizzy? Do I want to be flipper? I don't know.
What's your positive?
Oh, my positive, I came.
Hey.
I came to this.
The heaviest weight is the gym door.
That's a good way.
Yeah, the heaviest weight is the gym door.
This has been very informative. No, I'm messing with you. One thing that I noticed was during my bird dogs, I actually was pushing my weight to my hip, which made it a lot easier on my core. So when he told me push your hips to the side, I was like, oh dang, that makes it a lot harder. And then one positive, done a lot of workshops with Erin and a lot of work with Erin, and definitely some of the old compensation patterns I've really been working on it, and it's a lot better. So it's cool to see the progress over the year or two that we've done some work together. So thank you. Yeah. Proud of myself for showing up.
It was very informative. I noticed that, especially when I was doing the reaches with my leg, that it was showing a little bit of my right glute has been an issue. I noticed a couple of years ago, actually, when I was squatting, you could see that I was sagging more. So that's an issue that I haven't fully been really addressing in a corrective regimen, like doing an extra rep on the right every time. But it's showing me that it still needs a little bit of work, even though it's getting better. Everything's getting better in kind of a balanced way, which is just going to still keep it a little out of whack probably. So it's something to address. And then also notice with my bird dogs, which actually, since I hurt my back the last time I came to you, you're telling me I need to be doing a lot of that for my thoracolumbar, that whole area. I've been doing a lot of those exercises, and they have been really improving. But Destiny pointed out that I'm getting maybe a little lazy up here, so maybe I've got some rear delt work that needs to go into it, so I can reach a little higher. But yeah, I'm happy I showed up. I'm learning more things that I can share with my clients, and then checking myself so that I'm not presenting poor form. Yeah. My positive was just showing up and learning and doing the work and getting to observe everybody else and see what they're finding about themselves, and it's just tons of great information. Yeah, glad I came. I'm happy I'm here.
Your little googly eyes.
I didn't even think about
Your
it.
little googly eyes.
I was saying I didn't think about the microphone when you were talking.
Just make your hand up less than the character. Anyone else want to go?
Oh, we gotta finish up.
I mean, I feel like kind of just like what everyone else said, like I'm just like really thinking like the mind connection and everything with it. Just kind of like really think about like, okay, where should I be feeling this right now? Kind of like the whole pelvic tilt thing that you said with the glute bridges and stuff, kind of really activating that was kind of eye opening. And then making sure I'm actually like kicking my like straight backs for the bird dogs and everything. And like my positive is just like taking that next step to learning more about like the root cause and like what I need to keep working on.
All right.
Especially with my bowling. That's always.
Awesome. Thank you. And last but not least, the famous Suzanne.
Okay, fine. Okay, so once again, it's an issue for me about how I navigate my core around my Harrington rods in my spine and the asymmetry of that and how that balances from left to right, front to back, and in a spiral. So yeah, I've got some work to do, definitely on even some isometrics with some of this stuff. So that was a good eye opener again. Okay. And yeah, we're all good.
All right. And what's your positive?
What?
Your positive focus.
Oh, I was just glad to be here, and I was glad to be with friends that I haven't been able to spend time with. And so now I got to bring them here to the workshop, and you're having a good day.
Nice. Oh, thank you. Thank you so much. So I want to start. I want to say, or not start. I want to say thank you to everybody. I appreciate your time, but I do have a special offer. Well, we have a special offer for everyone. Because you guys did take the time out of your day and your life to come here, we are going to offer free discovery visits for everyone here today. A discovery visit. What this discovery visit is, it's the first step to solving your problem. We're going to put you through the whole, our whole exam, run you through the motions, tell you exactly what's going on, a little more deeper than what we did today. So like getting into which side do we contract? What do I need to feel in the movements, right? Like, why does my right hip hurt? We're going to get into a lot more of that. And again, like I said, that is the first step to getting better. So Miley and I will be hanging around, answering questions and getting that set up for you if that's something you're interested in. Just kind of like to follow up on that, like the discovery visit is like if you're okay being where you are, and you don't want to salute, like you don't, like you're fine, like, this is whatever, I don't care, right? Like you don't want to learn more about what's going on, you don't want to learn how to fix it, and you don't care if it gets worse, and you don't believe it'll get worse. This might not be the best use of your time, right? However,
Go ahead and suffer in the dark.
well, no, it's just like, no, everyone's time is valuable. You know what I mean? And like, if you don't want to, if it's not something you're interested in, like, I don't want you to like spend your time doing something you don't want to do for anybody, right? But if you are looking for a long-term solution and you don't want your hip or either anything else to get worse, and you have tried other stuff and you want to see what else is out there, I think this visit is especially good for you. It's completely free. It's an hour long, and you're going to get the very best that we have. So if that's something you want to sign up for, we are here for that. And we'll be setting up, getting that going. So with that being said, I want to say from the bottom of my heart, on behalf of myself, Dr. Miley, and the rest of the Connect team and FMP, thank you guys so much for being here. I truly appreciate it. And if y'all have the time, I would love to take a group picture for Instagram for us. But again, thank you. And we're here for any questions y'all might have. Thank you. Thanks, guys. All right. Are y'all okay with the group picture real quick? All right.